Hi, Chris Geller here again with Clinical Training Consulting Systems. We're going some more into conditions of the spine, osteoporosis, osteomalacia, and fibro. Three things I'm going to talk about in this section. When we talk about osteoporosis, we're talking about the losing of bone in the bone, meaning that you're losing density. So when women have, and actually women have that more than men, they lose 2% per year to 1% per men per year after 30. So this is where the bone becomes less dense. So when the bone becomes less dense, obviously that's going to set up to possibly failure, which could be a fracture. So one of the things that they'll do is they go through the doctor, they examine, obviously the x-ray shows that, and they'll get bone density tests. They may be on Fosamax, they may be on some medication. That's the doctor's call, that's not my call as a therapist or you as a trainer. From a training perspective, they need weight-bearing exercise. They need exercises like squats that work on the skeleton, loading the skeleton carefully. They need lat pull-down exercises. They need shoulder press. They need side raises. They need exercises that are going to load the joint. Even lower body squats without on their neck are great. Lunges, right? Anything that can load the hips, the weight-bearing joints, the ankles, the knee, the spine is going to create more bone. You got to talk about their diet. Are they getting enough vitamin D? Are they getting enough meat? Is it healthy? Is it balanced? And what's really important, are they cross-training? Are they doing things like yoga, swimming, hiking? Think outside the box. Don't just think about weight training in terms of weight training, but think about diet, holistic yoga, and I think match your approach with the client's personality. If they're not willing to be open to new things, then don't force it. But that's something I would do with someone osteoporosis client. Now, osteomalacia is a basically decalcification of the bone due to vitamin D deficiency, meaning the bone isn't osteopenic, but there's a breaking down of the bone. Similar to osteoporosis, but quite different. So they have a vitamin D deficiency. So you may want to ask them to see if you can talk to their doctor. They may have nutritionists. Same thing. You want to check in how's their diet. Are they getting vitamin D? Are they getting enough nutrients like broccoli? Greens, things that can stimulate and help vitamin D. Are they getting supplements? Are they doing things to help their body safely? And I think our role as a therapist and your role as a trainer is not to push medicine or Chinese herbs or things like that, supplement, but to stay naturally. What your scope of practice is, just like mine, is to be part of the team, but not to tell them what to do, but advise them in conjunction with the doctor. The doctor's in charge. So they need the same thing. They need exercise that stimulates the spine. They also need exercises that target the middle back. Again, things like, your rows, your one-arm rows, your rows for your rhomboids, reverse flies, things that work on the upper spine and the upper back. Okay? Fibromyalgia, probably one of the most painful conditions I can see that affects more than men. In the man, you'll see there's 11 of 18 tender points. And these tender points are from the occiput, which again is going to be here, to the suprascapular region, or upper I should say, upper traps, into the supraspinatus fossa, into the scapular region, into the gluteal fold, into the outer glutes, lateral epicondyle, lateral condyle of the tibia, and it's symmetrical. The pathophysiology of fibromyalgia is thought to be that something is causing, such as stress, a traumatic event, recent loss of a family member, divorce. Multiple things are going on that are causing stress to the client or the patient. What that does is that actually creates a lot of stress on the nervous system. Then the nervous system creates this tension. The tension forms trigger points. Trigger points are these knots. These knots are almost like clumpy mashed potatoes, and they get stiffer and stiffer, and they proliferate. They proliferate where they get tight, and they need to constantly stretch and use something like that. So what they benefit from is maybe even get some counseling, talking with therapists. They may be on some antidepressants, something that would help calm them down, but again in conjunction with their therapist and their doctor. Now from an exercise point of view, what's effective? The research shows, again, aquatherapy is phenomenal. Aquatherapy meaning walking in the water, swimming, yoga, doing poses such as Warrior 1, Warrior 2, anything to open up these areas that are tight is really pivotal. Support groups, walking with friends, light cardiovascular training, light circuit training, things to get the heart rate up, but you're not overloading them. And I think the biggest thing too is stretching post-working out, core training, and making it fun. Being there for them, keeping it motivating and light, but being uplifting and helping them without feeling like they're getting worn down. So that's a little about osteoporosis, osteomalacia, and fibromyalgia. And I encourage you to look more into this in the manual. And next we'll be talking about polymyalgia rheumatica.